Hey guys, welcome back to another video. For those of you that are new to this channel, I'd like to give a brief introduction of who I am. My name is Ethan Mix. I'm a neuromuscular therapist who's currently practicing in Hendersonville, North Carolina. A neuromuscular therapist is someone who spends their day treating people's nerve and muscle pain. There are many misconceptions about where people's pain is coming from. A lot of people prefer a chiropractor, they prefer a PT. There are many different ways of going about taking care of your pain.
As an NMT, I often find myself trying to explain to people the anatomy and physiology behind their pain patterns, whether it be anything like sciatica, just typical neck pain, low back pain, plantar fasciitis, TMJ, carpal tunnel syndrome, and the list goes on and on. If you have one of these pain patterns and you're already going down the rabbit hole of who to go see or what specialist to see to help you manage your pain, the purpose of this channel, the reason why I'm putting these videos together, is to help educate you guys about your pain. The whole idea here is to teach you guys and educate you guys about these pain patterns and where they're coming from. I really think that if you guys knew more about where your pain was coming from, it'd be easier for you guys to choose who to let help you manage your pain, whether you need a chiropractor or you need a PT. After I talk about the anatomy behind some of these pain patterns, I'm then going to show you a few things that you can try at home to help alleviate your own pain. That way you guys can save money, you don't have to go anywhere, you don't have to rely on someone else to help you with your pain patterns. Now, if these techniques that I show you don't work, if you guys are still in pain, you can try and book a session with me or another neuromuscular therapist in your area. Or if you guys are really starting to enjoy these videos in this series, maybe you would be interested in taking my online massage therapy workshop. In these workshops, I basically have a camera on my chest. It films everything that my hands do. I go over the anatomy again. I go over some of the techniques that I use in my practice that have proven to be effective at helping people alleviate their pain. So if at any point you guys are interested in taking one of those online workshops, I'll post the links below in the description box below this video. Now that you guys know who I am, what I do, what I'm all about, let's go ahead and get into today's video. In today's video, we're going to talk about shoulder pain. I'm going to go over some of the most common or popular shoulder pain patterns that I see in my practice. We're going to go over the anatomy and physiology behind each one of these pain patterns. After going over all of that, I'm going to show you guys a few things that you can try at home to help alleviate your pain, and show you guys some footage of a few things that I do in my practice to help people alleviate their shoulder pain, help restore range of motion. A lot of people complain that they have a lot of trouble raising their arm above their head or moving their shoulder or arm in some sort of way. By the time you guys are done watching this video, you're going to know a lot more about your shoulder pain. You're probably going to be able to diagnose where it's coming from, and you'll know exactly who to pursue or what type of a specialist to go see to help you manage your pain. Now, we're going to go over a few of the pain patterns that you can see on your screen. So if your shoulder pain resembles any of the pain patterns that you can see highlighted in red, this video is for you. The first pain pattern that we're going to take a look at comes from a muscle called supraspinatus. Now, in my opinion, the supraspinatus muscle is the most common muscle that I have to treat in my practice because of shoulder pain. The way that the supraspinatus muscle functions and where it's located in the shoulder might have a lot to do with why this muscle is so prone to injury or inflammation.
The supraspinatus muscle's origins lie at the supraspinatus fossa, located at this top medial angle of the scapula. The muscle then spans across the superior portion of our scapula, and it dips underneath the acromion process, this bony angle here. It then runs underneath the acromion process and grabs on to the greater tubercle of the humerus. The muscle is innervated by the suprascapular nerve coming from C5 and C6, and its blood supply is the suprascapular artery. This muscle's action is to assist the deltoid in abducting the arm, as it also stabilizes the glenohumeral joint. Notice when the arm is abducted that the space between the acromion process and the greater tubercle of the humerus, so the ball of the shoulder, and this bony angle here, that space gets narrowed. So in other words, that space starts pinching or starts impinging on this muscle as we raise our shoulder. Because of this narrowing of space, it's really easy to irritate the tendon of this muscle or the muscle itself.
Now again, this motion of taking the arm away from the body, or abducting the arm away from the body, during abduction, the space between the head of the humerus and the acromion process, this little bony angle on the top of your shoulder, that space really narrows. It can impinge on the tendon that slides underneath the acromion process and grabs on to the tubercle of the humerus. Or especially if you've fallen on your shoulder and you caught yourself like this, that space between those two bony landmarks can really pinch on the tendon of that supraspinatus muscle. Now, as long as you still have functionality with this muscle, as long as you don't have a rupture or a tear in the supraspinatus tendon, here are a few things that you can try at home that I recommend that might actually help you relieve that tension and restore range of motion in that muscle. Now, a lot of these self-help techniques are versions of trigger point therapy. One thing I would have to recommend you guys get if you're going to try some of these self-help techniques is this, the Trigger Point Therapy Workbook by Claire Davies. That's a really good book. This book is just loaded with information on trigger point therapy. It talks about pain patterns there. It talks about different ways you can use this Theracane or any of those massage therapy cane looking tools. That's going to show you pain patterns. It's going to go through a lot more detail. Basically take you through a lot of the stuff that I'm showing you guys in these videos. So if you guys want a good reference or a good know-how book, this is one that I highly recommend. I'll leave a little Amazon link in the description box below this video so you guys can check that one out. And then just a few other tools like the one that you saw in the book. This tool here is called the GoFit Massage Hook. I don't know if you guys can see that there. And I like this one. The reason why I picked this one, I think I got it at a Dunham's. I'm sure you can find some on Amazon. So again, I'll leave a few links to some of these Theracanes or massage hooks in the description box below the video as well. If you can't get a hold of one of these Theracanes or massage hooks, some people just put a tennis ball or racket ball. If you really want to dig in there, you can get a lacrosse ball or a pool cue, something pretty solid. But I personally like a tennis ball, something that's got a little bit of give to it. And you can put this on the wall and then put your trigger points on top of that. And I'll show you a few different techniques with this as well. So for supraspinatus, we're going to use this hook. If you guys don't have one, you can check out the link in the description box, or maybe you can use like the handle of an umbrella. If you have one, sometimes that's kind of a creative way of getting at these trigger points. But you want to go ahead and find that supraspinatus trigger point. Remember, you're going to go through the upper trapezius muscle, so sometimes you'll feel kind of that pain pattern run up over the ear and into the temple area. That's you hitting the trigger points in the upper trapezius. But once you get onto supraspinatus, you'll really feel it. You'll feel that little pain pattern kind of behind the shoulder here. And if you need help finding it, you can also do a little bit of abduction. See if you can feel that muscle moving underneath the Theracane here, underneath the muscle hook. Now once you find that spot, keep your shoulder relaxed and go ahead and just keep breathing through it. Take a couple deep breaths. They really go a long way. Try and keep that muscle as relaxed as possible. The pain on a scale of 1 to 10, it's totally normal for that pain level to get up to a 6 or a 7. You want it to be a little uncomfortable in the same way that a deep stretch kind of takes your breath away. So you've got a good trigger point and a good way to know that pain pattern's going away, or a good way to know that if you're hitting everything correctly is the tenderness just starts to kind of go down after a while. You can try a few pin and move techniques. You can move your shoulder and just kind of hang out until you feel everything sort of release in there. One way to avoid injury with this muscle is when you go to do abduction. So when you go to raise your arm up like this, or even above your head, you want to make sure that your thumb is pointed up when you abduct your arm. And the reason why is because if you medially rotate your arm or point your thumb down and try and do that same abduction, that space between those two bony landmarks narrows even more, and it makes it even more difficult for that supraspinatus muscle to do its job. So anytime you go to do abduction, make sure you have your thumb or your palm facing up. The next shoulder pain pattern that we're going to go over comes from a muscle called infraspinatus. So just as the supraspinatus muscle was located above the spine of your scapula, infraspinatus is going to be underneath it.
The infraspinatus is a thick triangular muscle that also helps stabilize the rotator cuff. It covers most of the lower segment of our scapula, as its origins are at the infraspinatus fossa on the posterior surface of the scapula, and its insertion runs out to the greater tubercle of the humerus. Its innervation is the suprascapular nerve, which also stems from C5 and C6, and its blood supply is the suprascapular artery and circumflex scapular artery. The action of this muscle is lateral and external rotation of the shoulder, abduction, and horizontal abduction of the arm at the shoulder joint.
The infraspinatus muscle is an external or lateral rotator of the shoulder. It's that external rotation at the shoulder. So one way people get a cramp or spasticity in this muscle is maybe reaching into the back seat or maybe pulling on a lawnmower cord too many times. I've seen a lot of people come in with pain in this muscle after a kayaking or canoeing trip. One good way to help determine if your pain is coming from this muscle is, again, to activate it, to do the motion that it's responsible for. Just go ahead and stand there. Keep your elbows against your body. You're gonna bend whatever arm you wanna test, right? So I have an L in my arm here. And then all you're gonna do is just laterally rotate that arm. You wanna make sure that you have all the dexterity that you want in that arm. You should be able to stand with your back against a wall and hit your wrist against the wall without getting a pain pattern that runs down the arm. Infraspinatus pain, especially if you press on some of the pain patterns, can really radiate down your arm. You might feel it go kind of all the way down the side of the hand, down through the pinky. It's that shoulder pain that runs all the way down. Now, one of the best ways that you can help treat this pain pattern at home is to hit the trigger points. For infraspinatus, we're also going to use the muscle hook. So just like you found supraspinatus up top, infraspinatus is underneath the spine of your scapula. So I like to come at it kind of from the side here. You can know that you're on it if you try and laterally rotate your shoulder. You'll feel that muscle tighten up underneath the hook and just kind of hang out with the hook there. You'll know you hit the right spot because you'll feel it kind of radiate down the arm. You'll feel it match the pain pattern in the diagram. And after you feel some of that tenderness kind of go away, after you can move it, try a few other spots on that same muscle. Maybe move further out towards the ball of the shoulder or further down towards that bottom corner of the scapula. That's another good one. I feel that one there. Once all of that releases, you should notice that your range of motion has increased when you laterally rotate your arm. Now, if you guys are really enjoying this video, please remember to hit that thumbs up button down below. Also, click the subscribe button and the notification bell if you want to be notified when I post more videos like this. The next pain pattern that we're going to go over is a lot like the infraspinatus pain pattern, but this pain pattern comes from the muscle called Teres Minor. Teres Minor pain oftentimes goes with infraspinatus pain. I'd say the most common profession or sport that causes pain in the Teres Minor muscle would be swimming. And the reason why is because that action really helps a swimmer pull that arm down. The motion of adduction, or adding your arm back to your body, has a lot to do with that pain pattern.
The teres minor muscle is the more narrow or elongated muscle underneath the infraspinatus. Its origin lies at the lateral border of the scapula, and its insertion is at the greater tuberosity of the humerus. This muscle is innervated by the axillary nerve from C5 to C6. Its blood supply is the circumflex scapular artery. The actions of this muscle are lateral or external rotation of the shoulder, as it also horizontally abducts the arm, so it brings our arm towards our body.
Lay down or lean up against a wall, and what you want to do is make sure that you have full range of motion when you raise your arm up above your head. A tight teres minor muscle will give you that pain pattern that kind of runs between the outer edge of your scapula out to your humerus. Or you might notice that your range of motion is limited. You might not be able to get your elbow all the way up parallel with your body. Now, a good way to find that muscle and see if there's tension in it is just to press on that spot that runs it's sort of on the back of your shoulder, almost on the top of the outer or lateral border of your shoulder blade. If that's tender, if it's tender for you to raise your arm up like this, chances are that Teres Minor muscle needs a little bit of work. Now with Teres Minor, you might not need to use the muscle hook. With Teres Minor, it should be pretty easy to find that muscle yourself. Right in the crook of your armpit, kind of in between the outer or lateral edge of your scapula. That muscle's going to be right in there, and you'll feel it. Teres Minor it's really tender on most people. It'll jump out. You'll feel that pain pattern, the one that matches that diagram. So you can kind of just hang out, keep your shoulder relaxed, and just see if you can soften that muscle with your fingers. Sometimes it's a little easier to do Teres Minor without the muscle hook. If you want to use the hook, the same way that you used it for Infraspinatus, you can go ahead and aim a little bit lower, almost in the armpit, or on that outer edge of the scapula. And again, you'll feel it when you hit it. Now, this next pain pattern that we're going to go over is usually hard for people to diagnose themselves because of how difficult it is to understand this muscle's function. The next pain pattern that we're going to talk about has to do with the muscle called Subscapularis.
The subscapularis muscle is a large triangular muscle which lies on the front or anterior surface of our scapula. Its origins lie at the subscapular fossa, as its insertion spans out towards the front of the shoulder at the lesser tubercle of the humerus. Its innervation is the upper and lower subscapular nerves from C5 and C6. Its blood supply is the subscapular artery, and the action of this muscle is medial or internal rotation of the head of the humerus. It also prevents anterior displacement of the humerus, so another major important stabilizer of the rotator cuff. Even though this muscle spans over the anterior surface of the scapula, it's surprisingly powerful at medially rotating the shoulder.
Now, the subscapularis muscle works with the pec muscle to help you medially rotate or internally rotate your shoulder. Now, as you all know, when you're doing a bench pressing motion, you're using your triceps, you're using your pec muscles to help pull your humerus in towards your sternum, right? But a lot of people aren't aware that one of their rotator cuff muscles gives them that extra push when you push the bar forward. So subscapularis, when it acts up or when you find spasticity in the subscapularis muscle, and it's going to feel like a deep ache or a deep pain inside the shoulder that also runs down the arm quite a bit. There can be an impingement on some nerves in the area. And what I often find with this muscle, or the tissues around this muscle, is that the fascia that's around the subscapularis muscle can really kind of mat down or glue the scapula to the rib cage. So when you go to do abduction or a few other movements, your scapula has to upwardly rotate as soon as your arm hits about 60 degrees or so. Now, to describe what I'm talking about here, how the scapula can get glued down to the rib cage, I am going to show you a clip from Dr. Gil Hedley's video. It's called The Fuzz Speech on YouTube. Dr. Gil Hedley has many cadaver videos. This is going to be footage of an actual human body. So if you guys are a little skittish, this might not be for you. Now, there's no blood or anything. If you guys want to skip through this little part of the video, I'll post the timestamp that you can fast forward to avoid seeing what you're about to see. But it shouldn't be that bad. Now, what you're looking at is a body that's laying prone or on its stomach. Notice on this left side here, underneath this left scapula, it's almost impossible to get underneath this person's shoulder blade. You can see how matted together these tissues are. This is someone that may have very well had a shoulder injury growing up. All of this collagen, scar tissue, and fascial tissue has really inhibited this person's range of motion with their shoulder. Now, as we look over underneath the right scapula, look at the difference between the two shoulders. Now, in my practice, to treat a shoulder that may be matted down like this, I don't have to use a scalpel to break up that fascial tissue that's gluing the shoulder blade down. I have other techniques that I can use to help break up the tissue underneath the scapula and around the subscapularis muscle. Now, subscapularis can be a little bit difficult to get to on your own, so if you have subscapularis pain, I would recommend just going ahead and booking a session, especially because of the whole Gil Headley video that I showed you. There's usually a lot of other issues that go around the subscapularis muscle. If you do want to try and hit subscapularis, you can kind of hold on to your other shoulder here, and you want to use this Theracane. You want to aim right on the front surface of your scapula. Some people like to do it with a broomstick or something. You can wedge the broom in a corner of a room, and you can get on that those front trigger points of the scapula. And again, just kind of hang out there, try and keep the muscles relaxed as possible. And you should kind of feel your scapula peel away from some of that scar tissue that hasn't matted against your rib cage. Another good indicator for subscapularis is you want to be able to reach your arm behind your back like this, and you want that scapula to wing out a little bit. You should be able to have somebody get their fingers underneath your shoulder blade. Now, if you guys are really enjoying this video, please remember to hit that thumbs up button down below. Also, click the subscribe button and the notification bell if you want to be notified when I post more videos like this. If you can't get underneath your shoulder blade with anything, again, go ahead and book a session. Come on in, and I've got a few techniques that'll help you free up your scapula. Now, those first 4 muscles that we've gone over are considered to be the 4 muscles of the rotator cuff. One good way to remember those 4 muscles is to remember the acronym SITS. A lot of you guys have heard of the SITS muscle group. SITS simply stands for Supraspinatus, Infraspinatus, Teres Minor, and Subscapularis. Now, a lot of shoulder pain or rotator cuff pain specialists focus on those 4 muscles, and most of the time it's one or a few of those muscles that's causing your shoulder pain. However, I want to take you a step further. I want to show you a few other muscles that are very, very common that can cause shoulder pain as well. So, the next muscle that we're going to go over is the long head of the bicep, in particular, the bicep tendon. If you have anterior shoulder pain that looks something like the pattern that you can see on your screen, chances are that that pain's coming from the long head of the bicep.
Now, although biceps brachii is not one of the 4 sits muscles or rotator cuff muscles, it does have a lot to do with anterior shoulder pain, so shoulder pain in the front of your shoulder. Now, as you all know, the word root bi in the beginning of the word biceps means 2, meaning the muscle splits into 2 muscles. The muscle has 2 heads. These 2 heads we call the long head and the short head. The origin of the long head of the bicep lies at the supraglenoid tubercle of the scapula. The origin of the short head lies at the coracoid process of the scapula. Both of these muscles then span down towards the elbow and insert at the radial tuberosity and the bicipital aponeurosis. Both portions of the bicep muscle are innervated by the musculocutaneous nerve from C5 to C6. The blood supply for both heads is the brachial artery. The actions of this muscle group is flexion and supination of the forearm at the elbow joint, as well as flexion of the arm at the shoulder joint.
The bicep tendon runs through a valley in your humerus bone that we call the bicipital groove. That tendon runs through that valley in the bone almost like a rope through a pulley. So if you can imagine tying a knot or fraying that rope that runs through that pulley, right? It's either going to get stuck in certain situations. A lot of people actually tear their bicep that way, and you'll see kind of a bulge or the bicep drops down towards the elbow because they've lost that tendon. A lot of people get surgery in this area as well. You might have a screw that tacked that tendon back in place, and ever since then you haven't been able to use your bicep without a little bit of pain. So one good way to determine if your anterior or front shoulder pain is coming from that bicep tendon is to isolate the movement of your bicep. So keep your palm facing forward. Don't use a hammer motion. A lot of people that do curls in the gym, they're doing curls with this hammer grip with the dumbbell. You don't realize that you're using this muscle in the front of your forearm more so than your bicep. So to isolate that motion in your bicep, you want to make sure that your palm is rotated towards your face, okay? Give yourself a little resistance. If you got to maybe try and pick up a table with it, try and isolate that movement there. Now, when you go to activate that muscle, at any point in that motion, if you feel that anterior shoulder pain, chances are you've got something going on with that bicep tendon. Now, as far as the bicep goes, the bicep's right in front. It's pretty easy to grab onto, so it's easy to find a couple of those trigger points just by using your fingers. Hang out, pinch on each head of the bicep until you feel some of those trigger point patterns start to go away. If you're getting the pain pattern up in the front of your shoulder from that bicep tendon, kind of grinding against things in that bony groove, just go ahead and free up that tendon as much as possible. You don't want to roll over it and clunk over that tendon because you'll irritate it or fray it even more. And obviously you don't want to do any of this if you've lost that tendon and you have that balled up bicep. If your bicep is hanging down by your elbow, it might be time to talk to an orthopedic surgeon because they may have to tack that tendon back in to its insertion up here. And last but not least, the last muscle that can contribute to your shoulder pain is the tricep muscle. If you guys spend a lot of time in the gym working out your triceps, a lot of the time these are pretty popular muscles to cause shoulder pain too.
Now, of course, the word root tri in the beginning of the word tricep indicates that this muscle has three heads. The lateral head and the medial head both originate at the posterior surface of the body of the humerus, as the long head originates at the infraglenoid tuberosity. All three heads of the muscle then span down the arm towards the elbow and insert at the olecranon of the ulna. The tricep muscle's innervation is the radial nerve, stemming from C6 to C8. Its blood supply is the deep brachial artery. The actions of the tricep muscle extends the forearm at the elbow as well as adducts the shoulder.
The pain pattern is going to look something like this. Sometimes it runs down to the elbow, but the same way that you raise your arm above your head, like you would for Teres Minor, right? If you then try and touch your back with that same arm, that same hand, if you feel any kind of pain running down into your elbow or at the base of your, kind of in the crook of your armpit, that could also be tricep muscle pain. That's something to consider, especially if you guys just did arm day or something in the gym and all the other muscles aren't really giving you problems. Now that's going to conclude our shoulder pain video. I really hope you guys learned something from it. And again, if you really enjoyed anything in that video, if I helped you get rid of your pain at home, or maybe if you came in, if you're already a client and you're watching these videos and you've already experienced what can happen on the table in here, please remember to help me out and click that thumbs up button, click that like button. If you guys want to be notified about when I post new videos like this, when I go over other pain patterns like low back pain, neck pain, even tension headaches, plantar fasciitis, if you like any of this stuff, go ahead and click that subscribe button, click the little notification bell as well, and you'll get notified every time I post a new video like this. And also, don't forget, if you guys are interested in taking one of my massage therapy workshops, maybe you guys don't want a massage therapy license, maybe you guys don't want to do this for a living, but you want to be able to help out your spouse or family member with some of these techniques. Don't forget that you can click one of the links below in the description box below this video to be referred to my website and sign up to take one of these online massage therapy workshops. Again, thank you guys for your time. Thanks for tuning in, and hopefully I'll see you in the next video.
Here it goes.